Well, what would a Thursday be without some technical difficulties, huh, folks?
Exactly.
I'm back.
Woo!
I hope everybody else is. Okay.
We got 320. Yeah.
All right, we'll just give folks a few minutes and apologize profusely to everyone. GoToWebinar is going to be hearing from me for sure. This is not supposed to happen.
I don't think we're webcasting like they said, because it just had an error message that just kept spinning and spinning and spinning, saying we would hit max, and I had to shut my computer down and come back in.
Oh gosh, I'm so sorry, Carol.
No, that's okay. That's okay. Do you want me to try to take controls back over, or?
Sure, I think it may work now. So I'm going to go ahead and make you the presenter.
And let me, before I show my screen, let me.
Good grief. Well, thank goodness it was just the advertisement, housekeeping stuff, and folks didn't.
Yeah.
Core content. So as you all are logging in, we apologize profusely. Yeah, I've been wanting to switch and go to webinar for a while. We just are locked into a contract, so.
Okay.
Oh gosh. All right, so we're in broadcast mode. So Carol, whenever you're ready, I think it's fine.
Yeah, I'm waiting for the PowerPoint to pull up. Hang on.
Okay.
Come on. Yeah, you may have to do it. It may not.
Okay.
Well, let me 2 seconds. If it doesn't work, we'll go back.
Okay.
Yep, not working.
Okay, I will launch.
Oh, wait, there it went. Of course, I say that, and then there it goes.
Okay, that's okay.
Aware of me. All right, let's go in and do this.
Great.
Of course, it's giving me the one, but that's okay. You've already gone through all your stuff, so.
I have. I just didn't introduce the both of you, but I can do either that in a second, or you can introduce yourselves, whatever you feel good about.
We're good. We're good. I'm just going to leave it on this at sharing, and hopefully everybody can see the PowerPoint.
Yep, we see it.
All right, awesome. Ready to rock and roll when you are, Gretchen.
Okay, I'll just do a really fast introduction of both of you. Again, we apologize you all as we're having lovely issues today, but our wonderful presenters who we've worked with for a number of years, and some of our favorite people are today's presenters. Carol Wick has advised nonprofits her entire career and understands its unique challenges. First as a therapist for abused children, and later as an award-winning CEO of one of the nation's largest domestic violence centers. She's since formed Charity, a global consulting firm with a mission to empower nonprofits to take control of their future and their fundraising. Her team is comprised of experienced nonprofit experts who bring decades of wisdom and experience to every project. Building on her exceptional 30-year track record of nonprofit management, community advocacy, and fundraising, Carol developed a model to assist nonprofits in assessing their ability to get to the next level. She is recognized as the foremost expert at turning around struggling organizations, using her business acumen to achieve financial stability, and her advocacy to engage the community as partners. So today we also have Ariadna Parada. She's a recent graduate with a passion for service. She uses her position at Charity Global to shed a light into social, cultural, and economic disparities. She enjoys building relationships so that individuals in our communities become motivated to help each other and help decrease inequalities around us. So Carol and Ariadna, thank you so much. I will turn this over to you, and I am here for you if anything else goes. I'm gonna turn my webcam off.
Thank you. Thank you so much, everybody. And, technical difficulties in this day and age are just part of what we're facing, isn't it? I mean, we I'm just thrilled to be here today, and I appreciate everybody hanging in and being on this webinar today. I'm so excited, and I'm really, really appreciative of Gretchen, of you, and the entire team, Ruth, everybody at NCADV for letting us share this study with everyone today, because I think that it could potentially be transformative for all of you. Ari and I were really honored to be able to work with the shelter in Collier County, Florida, and be able to create this presentation for her, or for them. And one of the things that I want to make sure we do today is that when we have, if you have questions, please put them in the chat box. We want to make sure that we catch all of your questions, and so we're going to try the best we can to try to answer every single question at the end. But if we can't, if you put your questions in the chat box, Ari and I will go back afterwards, and we'll try to answer all those questions and send out a document to everyone so we've got all of your questions answered best of our ability. So with that, I want to just tell you a little bit about myself. Thank you, Gretchen, for the introduction. And I know Ari's going to tell you a little about herself a little bit later on. But I have been working with women and girls for my entire career. I have about 35 years now. As Gretchen mentioned, I started out as a therapist working with the children, and then later, for nearly a decade, served as the CEO of a domestic violence center. And that experience and just built one on top of another, and it really changed the way that I approached problems and approached domestic violence, to be perfectly honest. I know that even today, when I have a for-profit company, domestic violence continues to be a passion of mine, whether it's working through legislation or working with domestic violence shelters across the country. I just absolutely, I think all of you know, as advocates, once you work in this movement, it just becomes part of your blood. And so this study has been a culmination of decades of my work, of shifting in the way that we communicate about the impact of domestic violence on local communities, so that we can get people to actually start listening to what we're saying. Now, you've all seen the headlines. Every single one of us, probably pick up the paper, and almost on a daily basis, you're seeing this type of headline. And whether it's USA Today, or this was one in Orlando Weekly just happened yesterday, and we're seeing that the impact of COVID is being pushed out there by advocates, which is great. I mean, we are really trying to communicate and help people understand how the pandemic, on top of regular epidemic of domestic violence, has exponentially increased the danger for survivors. And you all are the ones that are getting the calls. I mean, you know what this is like. You know what it's like to already be overwhelmed, to have 4 or 5 jobs, to not have the resources to be able to help every single person that you need to help. And so when we're talking about, our best guess is a 20% increase in demand for services, and in some places we're seeing up to 80% increases in demand for services, we know that the resources that you already have been stretched thin. So how in the world are we going to meet the need that we know is coming, the second wave of the pandemic? And how do you, more importantly, make the case that the domestic violence programs are as critically important as, say, the food banks? And I can tell you from just having had conversations with several of my clients that food banks and other services like that, their fundraising is just through the roof. They're actually having better months than they've had in multiple years. So we want to make sure that domestic violence providers are positioned very clearly to be able to show the value and the importance, because funding is shifting. I mean, I'm sure most of you have had to cancel special events, and I'm sure that you've had to go on and maybe do a virtual event, you've had to do something different. But What we're looking at now is not only funders demanding that you show impact and value, but there's for the potential of the government forcing foundations and donor advised funds to give up to 5 or 10% more in this next fiscal year, which would potentially pump billions of dollars into philanthropy and be available for nonprofits. So how do you make sure that you can prove that you are a good investment so that you can capture some of those funds that will be pouring out of all of these new sources? And so in the chat, as we're going through, I'd love to have you, answer some of the questions, but I'd love to know, how is the pandemic affecting you and your community? Is your fundraising up? Is it down? Or are you struggling to help, even with all of these headlines, are you struggling to help people understand the extent of the challenges that you're having? So please let us know in the chat box. And sorry, it went backwards, sorry. The study itself, as I mentioned, was commissioned by the shelter, which is in Collier County. And they came to us and asked us if we could replicate the Chanley study, which was done in 2001, which did basically a return on investment evaluation of the benefits of domestic violence programs. And I had worked in the past with a shelter to help them develop outcome measures for their programs so that they could increase their funding for those programs. So this was another tool in their toolbox to be able to tell their story in a different way. But what I wanted to do is I wanted to make the information more robust and give them more tools. So we added in some additional tools that talked about the impact that abusers have on the community. So the negative impact of domestic violence as a crime, as the injuries, the impact of the medical community and the business community. Because we wanted to really show and give them this local information so that they could not just talk about the benefit of their programs, but why those programs were so critically important. So why local? Why is it so critically important that we talk about local data? Well, every single time that there is a domestic violence homicide or serious incident, it seems like the first thing the media does is they go to NCADV's website, they pull down some statistics that are national statistics. And so here you have a woman who was killed by an abuser in your local community, and they're giving numbers and reporting numbers that are so large that they basically, people just tune out. Because when we start talking about billions of dollars, it doesn't mean anything to them personally. And we all know that if we're going to get people engaged in fighting the epidemic of domestic violence, then we really have to make it real for them personally. We have to help the CEO understand why it's important to their business, why it's an economic drain. We have to help the doctors understand that they're seeing many, many more injuries than they think they're due. And we have to help the government officials understand that they're spending money arresting and letting abusers go when they're probably going to continue to abuse or potentially kill or commit a mass murder. And that those wasted dollars are not helping solve the problem. Your programs can solve the problem. And that's the point of local data. And that's why it's so critically important that you stop using the national numbers when you talk about your local community and have the ability to calculate this data for yourself. So we used quite a few different tools. Some of them you may be familiar with, and some of them we adapted with the permission of the researchers. So the Texas Health Domestic Violence Cost Calculator is one that I used for years. It's designed to help you calculate for a business what the economic cost of domestic violence is and how many potential victims, female victims, that they have in their community or in their business. But if you use the census and you calculate that information across the entire county, you can actually start to calculate a lot of other really rich and robust data that you can use. We also use the RAND cost of crime calculator. And this was a tool that was developed to estimate what would happen if you either increased or decreased law enforcement officers, how that impacted how much money the community was then spending on crime. Well, if you kept some of those numbers static, then you can actually look at domestic violence crimes, use the RAND calculator. And I pointed out these two because these are heavily researched, evidence-based tools. So you don't have to worry about coming up with these numbers on your own. We've got the data here and the backing and the evidence that proves that this data is really good and strong data. And some of the other things that we used were in Florida, we used the Florida Department of Law Enforcement crime data. We used the United Way Alice reports. We also used formulas that were in the Chanley study. And then because everything was in different years, the RAND calculator has a great link that takes you to the IRS cost of inflation calculator. It's called the CPI. That calculator is really powerful and allows us to bring everything up to, in this case, we used 2018 because that was the last year that we had crime data for. So we made it consistent and put everything in 2018 dollars. Now, for the purposes of this presentation, we are not going to go through a really detailed how did we get the numbers, because that would take forever and it would probably make some of your eyes glaze over. So we're just going to kind of do some highlights here and give you a taste of the kind of information that we were able to develop, and then you can later go on and download the report. So the first bit of information I want to share with you comes from that RAND calculator. And again, using domestic violence crime that was reported by the Florida Department of Law Enforcement, we were actually able to go in and show that in Collier County, which is a fairly small community, it's not, parts of it are very rural, in fact, and very highly immigrant, a lot of crop growing and folks that come through there just to pick crops. And then there's obviously one of the wealthiest areas in the nation, also in Collier County, in Naples. And so in this one community, the cost of just these crimes that we calculated was nearly $200 million on this one community. So these are all the different things that we're talking about in terms of juvenile justice costs, criminal costs, court costs, law enforcement costs. So you can imagine the economic drain on a small county when you're talking about just the crimes committed by domestic violence offenders. $200 million. Now that will actually get some attention if you're able to bring those numbers forward when you're having your next conversation with the local government official. And you can also imagine what having just a small portion of that for your programs would really make a difference in how you could serve survivors. So I do also want to mention that when you're using the Texas Health Cost Calculator, it does only talk about female victims and survivors, because we know that the vast majority of survivors who are injured are in fact female. So it doesn't discount men, but the calculator just calculates female survivors. And I think that the reason I love this slide and I use this data a lot is because in the importance of the medical community in domestic violence it just can't be understated. Oftentimes physicians and healthcare providers, they don't even understand the magnitude of what they're seeing, even obstetricians. And we know that the leading cause of death among women, or violent death among pregnant women, is domestic violence. In fact, there's some studies say that it is the leading cause, period, among pregnant women, and yet how many obstetricians, one, screen, or two, screen at every single visit, which is what they should be doing.
Angel.
Again, in Collier
woke up in a palace with three rolling on the floor, laughing emoji. Handful said laughed at someone woke up in the palace this morning with three rolling on the floor.
Sounds like we've got something else streaming on here.
I don't know what on earth that is. So
He has.
I don't know. You hear it
oh my
too?
word.
That's interesting. Maybe we can mute everybody but me and Ari, but
Yeah, Everyone is, so I think it's a go-to thing. I will continue to.
All right, well, I'm going to keep rolling, and if we're hearing something about the palace, you know, maybe we're listening to something really interesting here. So or whatever he was chatting about. But so when we're, again, talking about medical costs, and if you're sitting down and one of the best sources of funding sometimes in your community is your medical system, the hospital system. They have a lot of money they have to give back into the community. And oftentimes we'll fund things if you can show that you're going to be reducing their costs. So again, Collier County, Florida, we had about 25,000 injuries resulting from domestic violence abusers attacking their partner that required almost 14,000 medical visits. And we're looking at over $33 million just to the cost to the medical system. You know, and when I was at Harbor House, we created an R3 app, which allowed doctors to screen. And if you provide them with the tools, they will do it. But oftentimes they have to see the economic ROI in order to put their resources towards addressing this issue. So it's really important that they see how many patients that they may be seeing that are coming through that have injuries that are directly related to being assaulted by their batterer. So if you guys have any questions, please, please, please ask them in the chat box, and I promise I will get to them as we get toward the end. But I would love to hear from you. You know, what are the conversations that you might have with the medical providers in your community if you have this kind of data at your fingertips? How might that shift those conversations?
So I'm happy to, Carol, if you want, I'm happy to share those comments as they come in.
Well, yeah, that would be great. And then Ari, I'm going to pass it over to Ari to talk about the social costs and benefits. But yeah, if you have some great, are there some comments in the chat box you can share?
Sure. Yeah, I think I'm not seeing any come in. Some questions that we can answer at the end, but nothing specific to what you just asked.
Okay, great. Ari, if you want to take over.
Awesome. Okay. Hi, guys. My name is Ariadna Parada, and I'm from El Salvador. So, saludos a mi comunidad latina. I would love to hear where each and every one of you are from in the chat box, if you want to share that. I just recently graduated with a degree in international business, as Gretchen was mentioning, but I've always definitely had a passion for service, for social justice and social change. And that's why I'm really thankful to Carol and the Charity team, as well as NCADV, for allowing us to share our study on such a large platform, and especially now when percentages of domestic violence are going up 20, 80%, as Carol mentioned, because of COVID. I think it's really important to talk about it. Growing up in El Salvador, I never really heard about domestic violence as an issue. So I think it's really important that we're talking about it now and talking about the social benefits that it provides within our local communities. I also want to get to know from you guys if you grew up in a country or a culture that didn't talk about domestic violence. So you can put that in the chat too. So I'm not going to go over like the nitty-gritty parts of how we obtain the cost-benefit analysis, but I am going to talk to you a little bit about the process and the data that we obtained in order to calculate the return on investment. So when we talk about social cost, what do we mean by social cost? So in relation to this study specifically, we said that the social cost was whatever money domestic violence survivors and programs are taking out of the community. So in other words, we can say that what do survivors need to support themselves, and what taxpayers and donors are paying to run the programs. So we came up with basically 4 components, and those include the cost of emergency shelters, the cost of counseling services, and the cost of market rate labor. And we did this including volunteers, because many times advocates are paid less than market value because they work for nonprofits and they're operating at a lower budget. And then finally, we determined the welfare benefits. And these are the benefits that survivors need to stay free from their abusers. And those include food stamps, cash assistance, as well as Medicaid. So on the other hand, we have the social benefits. And the social benefits are the positive outcomes that the services the shelter provides to survivors have a great impact on the community. So we came up with 4 main components, which is the immediate injuries averted, long-term injuries averted, economic stability, and mental health. And when we talk about immediate injuries and long-term injuries, Chanley came up with a really important percentage, which was that up to 95% of survivors coming into emergency shelters could be protected from future assaults. And I want to highlight this especially because Carol mentioned that there were around 14,000 required medical visits, and out of those, there were around 25,000 that resulted that domestic violence survivors had from the assaults that they were receiving. So I think this is a really important data point that you can bring up, especially to those of you that want to go and pitch to a donor or to an investor. It's really cool when you talk about how COVID is bringing up the stats of domestic violence shelters, and that how we need more shelter beds in our shelters. But imagine bringing up the local data of what you have in your community, saying, you know, there are 14,000 required medical visits from domestic violence victims in 1 year. And we can have 95% of those survivors that are coming into our emergency shelter be protected from any future assaults. So I think that brings another level of detail into your language, and it can help persuade a lot better to get a better outcome for your shelters. So with that, we also talked about like economic stability and how that helps survivors not return to their abusers or not become homeless. And we also talked about the value of mental health counseling services that the shelter provided. So then we're going to go into our final calculation, which was return on investment. And Chanley used a numerous amount of studies to determine, you know, all those numbers that Carol was saying that we're not going to go into, but they were able to determine a conservative estimate, which is a lower estimate. And then they also determined a less conservative and a more aggressive approach, which was the upper estimate. So it's depending on the data, but you can be either conservative or you can be a little bit more aggressive, or you can shoot 2 birds with 1 stone and be average. So either way, it's important to understand that you have a range of data, and you can use that data determining what you want to get out of the picture for your social benefits and social costs. But either way, you know, like it's important to understand that there is an upper and lower estimate in this specific study. And with that, on the low end, the lower estimate, the shelter had a social cost of little over $7 million, whereas their social benefits were nearly $13 million. And then the upper estimate, they had a social cost of $7.5 million and a social benefit of little over $52 million. So when you're bringing that into conversation, the shelter actually has an operating budget of $5 million a year in 2018. And when you say, hey, we have a budget of $5 million, but we can bring a social benefit of $52 million, like that changes like the whole perspective, right? So another way to consider that is that for every dollar invested with the shelter for combating domestic violence in Collier County, taxpayers save an average of $4.40.
That was, and that's a really powerful way to talk about the investment with your center. And the amazing thing is that we were able to go in and actually talk about the economic impact of the counseling services. And we're talking about how important the emergency shelter is, not just from Shelter Saves Lives, but actually being able to give hard numbers behind that. I mean, I think about how many times I went out and talked to donors or talked to a community group and wished I'd been able to have this kind of data. Well, now you can have that at your fingertips and be able to share with people the actual impact of these programs from an economic standpoint. So the most important thing, though, is how we use this data, right? I mean, the report that you're going to download is, I think, something that you can go out and send to people. But a lot of times when studies like this happen, they end up just sitting on a shelf, collecting dust, and people don't know how to actually use the information. And so that's one of the things that we really wanted to share with you is some different strategies that you could use, because reports like this are great as a whole document, but as you pull the data out for different audiences and different situations, it makes every conversation that you have, every single social media post that you make, so much more powerful. And as I mentioned before, the philanthropic community is shifting. So we already know that special events are kind of a thing of the past, at least for in the near future. And many of you had events that were either canceled or went viral, or virtual rather. So what's the future? Well, the future is going to be major gifts, and it's going to be those foundations and government sources. But the funding is going to be a lot tighter. I know just even here in Florida, we're projecting billions of dollars of losses because most of our state revenue comes from tax dollars. So we have to be prepared, and we have to be able to communicate in the way that philanthropists want us to communicate, which is having really strong plans and really strong outcomes. So what you can do, for instance, is when you're meeting with businesses in the future, use that Texas Health Cost Calculator, run the data for that company, and have that on a piece of paper when you go to meet with them and show them the impact that domestic violence is having on their company. It changes the conversation from I'm here to ask you for money to I'm here to help you economically save your business and protect workplace shootings and workplace violence. And that's a different kind of conversation. It makes you a partner, not in a one-down position, which I think is something that they appreciate, and then they'll also support and invest in. And again, going and talking to hospital systems and talking to them about injuries that they may be going undiagnosed. And we know that when a woman seeks care, it's on average about $1,700 more per visit in unnecessary tests and misdiagnosis when they don't ask questions about domestic violence and find out what's really going on. And they're also not averting those injuries in the future. So I'd love to know, just given what you know so far, how would you use some of this data in your community? Please put it in the chat box. And if you have questions or thoughts about that, I'd love to be able to share those with everybody else. So the next thing that we did was we created this infographic, and this is actually in the report. It shows you, though, how you can tell your story differently. And I know every single year we did an annual report, and we used what were our actually outputs and not outcomes, but we called them impact. So little thing I always like to tell all my clients, anything you can count on your fingers is an output. So for instance, on this infographic, the 24,000 hours of counseling that they provided is tremendous. They helped so many people, but it doesn't say what happened because they had a counseling session. So that, for me as a philanthropist, that might not mean a whole lot. It means that you're doing a lot, but does it mean it's actually ending domestic violence? Well, then we can go back and we can also say, based on the research and the data that we found, that the counseling services provided by the shelter saves taxpayers $120,000 a year. So not only is it helping survivors, but it's a good investment financially. And then of course we have the 95% decrease in reduced injuries and assault. And then for this, I use the upper estimates, which is a $52 million worth of benefit that this $5 million organization is putting back into the community, and a 7-to-1 return on investment. So you can see how powerful that is. And it's completely different conversation from just saying, this is how many safety plans we did, or this is how many people we sheltered, and just counting out rote numbers for your impact report every year. So I also want to talk about some other ways that you can talk about data. And heat maps is one of my favorite things to use, but not just heat maps, interactive heat maps. And again, the more you can draw data down to a local level, the more powerful it is. And so what we did was we used interactive maps online where we actually had multiple layers of data. But if I wanted to click on my zip code, I could click on it and I could see what was happening that had to do with domestic violence in my neighborhood, in my community. And we used data points that you don't normally think of. So we didn't just use 911 calls and hotline calls. We also used outreach calls and injunctions. We pulled data from the child welfare services and that was related to domestic violence and put that in there. Some years we actually also included information around animal abuse. But one of the things that we found is when we did this data this way, we were able to show that yes, the concentrations of the numbers were in the areas with high crime and high poverty, because that's what we see, right? But that's where law enforcement's more likely to go out to. But we were also seeing large numbers of outreach clients and injunctions in those gated communities and the higher net worth areas. So we were able to actually have conversations about, look, this isn't just happening in the high poverty areas. This is happening in our entire community. And we have to have multiple strategies to reach survivors, which is again, why the businesses and the churches and our faith community and our medical providers became such a critical component for our community outreach strategy. So I want to tell you a little quick story about shifting the way that you use data. And I don't know if anybody has had this experience, if you've used a chart like this to show how the government needs to give you more money or a funder should give you more money. But when I first started at Harbor House, I thought it was really clever. I took the amount of government money, which had stayed fairly flat and actually had been cut right before, not too long after I had gotten there, and how every single year the number of people that we were serving was going up, but their funding either stayed flat or dropped. And I was trying to justify the need for why we needed more funding. And so the response was not what I had expected. And I thought I had made a really great case for support, but unfortunately the response was, you are doing such a better job with the money that we're giving you and making it go further. We really appreciate that. And they actually gave me a contract that required that I serve more for less, even though our cost for service was actually going up. So I knew at that point that I had to do something dramatically different. It was just not going to work. So I changed the next year to this. And again, this was a great opportunity for me to show how we were able to, the taxpayers were paying $24 million a year to arrest abusers, investigate child abuse in homes where abusers were abusing their partner, and release them. We'd had 2 mass murders that year, and it was continuing to escalate. So I was able to discuss with them how they were spending all these millions and millions of dollars not solving the problem, but they could invest in our programs and we could actually start to save the taxpayers money, but reduce these numbers as well. And they actually increased our funding and gave us our own line item in the county budget. All right, so I want to very quickly here, I know we are running up against 2 o'clock, but I wanted to show you where you can download this report. If you go to the charityglobal.com website, you can, it's charityglobal.com/DV dash case study. You can download the report and we will email you a link to get that. And we spent some time, did it really nice. It's a beautiful report, and I hope it answers a lot of questions. It also lays out a lot of how the data was calculated and gives all the resources. So please go on our website, download the report. While you're there, we have a lot of free resources. I mean, we are in this together. I know what it's like to reuse the foam boards from a special event and make them into a bulletin board in a classroom. You know, I know what it's like to let staff go and be the person that's answering the phone and, you know, having to go pick up trash and do all of those things because that's what needed to be done. And we're all in that place at different times. But our assessments, the information that we're going to be providing you, everything is going to be free. We're going to be starting an online community to help you use this data. I'm going to be producing some very short videos that we'll be sending out to you, and we'll be able to walk you through how you can calculate this data for yourself and for your local community. So really want to help you improve your fundraising. Like I said, this has been a lifelong passion of mine, and I really want to make sure that you've got the tools that you need to be able to do your job better. And a couple of our free assessments help you with capacity building and help you determine, do you have all the things in place that philanthropists are looking for in order to give you a major gift? So with that, Gretchen, I'm going to turn it over to you and we'll answer some questions.
Great, thank you. Yes, people have been posting comments and whatnot in the question box. So I have a handful here, so just bear with me. I'm going to scroll up and see where they start. But yes, most people are interested in where they can get the heat map that you were showing and if that's available in their local area.
So I did that heat map in partnership with the University of Central Florida, and they use GIS mapping on that. A lot of times your local universities can do that for you for free or will do that for you for free. But the beautiful thing is with technology, some of that's free on the web. So you can actually use an Excel spreadsheet and it will create a heat map for you. So there's no need to pay anybody to do something like that. You can actually create that. Now, if you want to make it interactive like I did on the web, that's going to take a little bit more technology. And that's where we did have our web designer create an interactive map to put on the website.
Great. Okay, someone asked, do you have any information on spouses of active duty military concerning domestic violence? So she is a military family life counselor.
Yeah, so the beautiful thing about using some of these calculators is you can adapt them, like the Texas Health Cost Calculator, for instance. You can adapt that and enter in the number of active duty military that are on a base, for instance, and determine how, you include the total population like you would census data for county, where you've got the spouses and that sort of thing, and you'd be able to actually go in and calculate that. It probably does not estimate what we would expect might be a higher rate of domestic violence in the military and law enforcement and some of those positions that attract people who are more inclined to power and control. But if you had a number where you could change the data is actually on the spreadsheet, so you can actually go in there and take a look at it. So you could potentially put in some different numbers and get that increase for your population, but it would at least give you a conservative estimate.
Okay, awesome, thank you. How is the cost of emotional psychological abuse factored into the healthcare costs, or is this exclusive to costs associated with physical violence, like visits to the ER?
Right, so we did, there is actually mental health costs in there, and the nice thing is there's mental health costs and benefit of your programs and services. So the Texas Health Instrument, again, we couldn't show all of the data, but it is in the report. It shows the impact of mental health costs and visits. So And part of the RAND calculator and some of the Cheney work, and Ari may be able to speak to this a little bit, actually calculates that mental health impact and the impact of trauma on productivity and absenteeism and things like that.
I think you said that right. No.
Sorry, we've got, let's see. Some are comments. People are saying that yes, that it is silence in their community, like we normally hear. Cultures, we're not addressing domestic violence. Let's see. Can you talk briefly about the role of the faith community in bringing about social change and the need of training clergy?
Right. So I have, again, I created a model several years ago called Project Courage when I was at Harbor House. And it was a strategy to engage businesses, the regular community, first responders, and schools, and the faith community. And in each one of those, we created a different engagement strategy because each one had a different reason why they would not engage. And with the faith community, you have to understand that they don't want to acknowledge, or they're hesitant to acknowledge, most of them, that domestic violence is happening amongst their congregation. They'll solve a problem outside of their congregation, but they don't really want to admit that it's happening to maybe their elders or abusing their partners after they go home from church on Saturday or Sunday. So what we did was we actually started We actually started the first weekend of October, what we call Preach-In. And I got faith leaders from all different faiths to talk about in front of their congregation what love was, what their faith said healthy, respectful relationships were. So we came at it from a healthy relationship perspective. And then we created a training because what happened almost immediately was the pastors and the rabbis and the imams contacted us and said, we had no idea we had this kind of problem. Will you train us? So we were able to go in and train them on how to respond. But in terms of using local data, the local census data is really powerful talking to them. But my experience, the success with the faith community is really coming at it from what's a healthy relationship. And then once they define that, you have people coming forward and saying, okay, this is a safe place to talk, or it's not. And so then what we also had was survivors coming to us saying, thank you so much for showing us the churches that were preaching about this, because now I have a safe place to worship. It had a double benefit of social change.
Excellent. Okay, other people are asking to give examples of strategies as to how they can use this information to their advantage.
Right. So that's part of the reason we decided to create this online community, because what we'd love to be able to do is to show you examples, to post these videos, and also be able to have you share with each other. When I was a CEO, I had a philosophy that we give away the information for free, because this is all of us fighting violence against women on a global level. And so if we can't share our ideas and successes, then we're in this for the wrong reasons. So I want to create that online community, and we'll be sending out some information about that. But again, you can use this data when you go in to meet with your corporate donors. We actually created an earned revenue stream by training corporations on how to become safe workplace environments and recognize domestic violence in their workforce, and how to respond appropriately to it. You can work with your medical providers and increase the amount of screening that they're doing. And then once they start engaging and putting some of these practices in place, all of a sudden it's in their face. They can't not address the issue now because people are coming forward. And so then they rely on you as a partner, not as someone who's just another charity asking for a sponsorship. And it changes the dynamic. And my experience, not that we did it to get more money, but my experience has been that when you create that partnership and they see you as an organization helping them and helping their employees, they're more willing to make really large gifts and major gifts. then, and you become a priority in terms of their funding strategy.
Excellent, thank you. A few people have asked where they can find health cost calculators.
Yeah, if you download the report, all the hyperlinks to all of the places that we use data are in the report. So everything's in there. So you can just click on the hyperlinks and it'll take you right to where they are on the web.
Great. Another question is, who is registering the benefits / positive impact of those men who complete their AIP program and did not recur in their abusive behaviors?
So there are some, if you think about it, if you were to use the RAND calculator, and in the RAND calculator, you can actually calculate how much every single act of assault, rape, aggravated assault, how much that costs the community. And so if you were able to say then, we have, prior to this person taking our program, they committed this many acts of violence, and you could, essentially survey your people and have them give you a number if they would. I mean, you could do it anonymously or whatever. You could do it just in aggregate data. But then you could actually show that those that don't recidivate, that don't commit offenses again, you could show an economic cost and an economic value of that, of those reduction in assaults. And there's also assaults averted. There's cost of assault averted for the shelter. So you have both of those numbers that you could use. And again, that's why I love this data. You can take it, look at it in lots of different ways and apply it to lots of different programs.
Great. Okay. Let's see. How would you recommend agencies that work with a specific subpopulation use data differently? For example, she works for a Jewish domestic violence agency.
Well, again, I think one of the things that's really important is when you're going in and talking to groups, being able to say, in your business, in our, if you're approaching it from a cultural perspective, being able to say that we know that the research shows that, I know that the NCADV has been putting in a lot of stuff about Native Americans and the increase, the how much higher the rate of violence is amongst women in reservations in the Native American population. So you could actually add in that percentage, that increase. Off the top of my head, I don't have that for the Jewish community, but you could talk about what that looks like. So you can use the data, not just with the hard numbers, but you can storytell the data as well. And I think, again, having the local data and being able to then say, this is what this means to the synagogue, this is what this means to your business, this is what it means to our community is really important.
Great. Okay. Here's another question. Does the report include any data about the possible increase of gun ownership by IPV perpetrators? And what is the related law in that county about gun ownership by abusers?
Yeah, we didn't touch on gun ownership. I mean, we all know that having a gun present increases the likelihood that a survivor will be killed. And, again, I think you could extrapolate gun ownership. You could say, the homicide numbers, you could add an economic impact to that. You could probably, there is a cost for every homicide. So you could potentially say that we have this kind of gun ownership. This is what the potential increase in the economic cost could be. It might be a little bit of a stretch. I'd have to sit down and look at the numbers and see how you would do that, but we didn't specifically address that in this report. But I love the idea because there are a lot of different ways that you can go and use data to make your argument so much more powerful.
Excellent. Okay. Another person says, our police department created a DV unit about a year ago, and there are currently only 2 of us handling all of the cases. We are trying to get our higher ups and politicians to understand the need to expand the unit. Is there any data on the benefit of these kind of units that we can present to make our case?
Well, so the really fabulous thing about the RAND calculator is it was designed to show the impact of increasing the number of law enforcement officers. on crime. So that's a perfect tool for you to use. You can take the RAND calculator, you can show what the department is now too, and what would happen if we doubled it, and it will actually show you how that will have an effect economically on the amount of crime that you have. Just make sure if you're using any of these tools that you're also using that CPI inflation calculator and bringing it up to current year data, because a lot of the data is not in the current year.
Okay. Awesome, thank you. Sorry. I'm going through the questions right now. Let's see. Okay, thank you for this informative presentation. I am a researcher who focuses on the intersection of DV and guns. We are really interested in looking at the cost of the deadly role of guns in DV in terms of physical, mental, and emotional costs. Have you done any work on this? Any insights into what resources I should consider for this work?
You know, I haven't done anything on guns and DV. I know that NCADV is doing a lot on that.
Yeah.
And I know, you know, I'm part of Moms Against Guns. But I think that I think it shows a need of how we need to be able to have some calculators. And I think the important thing is not just calculating it at a national level, but again, being able to make sure that we've got the ability to calculate this with local data, so that it's meaningful. We're going in and having conversations that might change the way that judges, for instance, make decisions around injunctions, or legislators start to make decisions around how we implement removing guns from abusers that have either been arrested or have an injunction against.
Great. All right, so do you have any ideas how the data can be used to educate the impact of DV with services providing intervention for perpetrators?
Well, again, we kind of talked about that, how you could potentially use the number of assaults, predicted assaults prior to, and then the recidivism rate, and then you could calculate an economic cost of that. You know, feel free to contact me, carol.wick@charityglobal.com. I'm happy to have a conversation with you about that, and help you kind of walk through the process of how that might be able to be calculated. That could be really powerful.
Also, once you read the study, it also gives like a peer review, like the examples that can be made regarding all of the tools that we need.
Awesome. Okay, how do you get started? What would be the first 3 things, ideas? Like what would be the first few things to get started with?
Yeah, I think the first thing would be to try out the domestic violence cost calculator. I think it's a fairly easy tool to use. You can use it both for a business maybe that you're getting ready to go talk to, or you could use it countywide and have that data. So that becomes a really quick and simple tool because it only uses 2 different things. It uses the census data and it uses the cost calculator. The channeling, the ROI and all that, it gets a little complicated, and that's why we're going to be doing some videos to kind of walk you through that. And Ari and I have went back and forth quite a bit, and we have spreadsheets and all kinds of things that we use behind the scenes. The other one would be the RAND, and I think the RAND calculator again is you use your Florida Department and or your law enforcement data that's reported up to DOJ. So every state has the data. It may or may not be as accurate as you want. And again, I think, you know, one little caution about data, and this is a particular pet peeve of mine, the definition of domestic violence, a criminal definition of domestic violence is different in every single state. In Florida, DV is not just intimate partner violence. It's also family members. And in Tennessee, for instance, it could be roommates that don't even have a relationship other than they're sharing an apartment together. So we have to be really careful with this. We're being very clear about the data, and the clearer we can get the data. So if we're talking intimate partner violence, we really have to be careful and make sure that we're also looking at, is that what we're really saying? Or are we being clear with people that this isn't just intimate partner, this is also this other definition. So do know that when you're using the data that you're being very, very clear, and we're not doing apples to oranges and saying they're apples to apples, because that then makes us look like we're not being honest and we're not having integrity in the data, when in fact I think people go intimate partner violence when they hear DV, and that's not necessarily what the criminal code is.
Great. Okay, can you explain how a DV victim is an out-of-pocket expenditure of the hospital treating the victim of DV? She understands the negative net value to the community. I would like clarity on one piece.
So there is a study, it's not in our report, but there is a study out there that shows that, and I'd have to look at the year, and you might have to bring it forward again with the cost calculator, but the last time I looked, it was about $1,700 every single time a survivor is misdiagnosed, where they come in to the emergency room, or they come in to see their doctor, they have an injury, the injury is caused by their abuser, and they misdiagnose it because they either don't screen, or the abuser's in the room and they don't tell the doctor what really happened. So that is an out-of-pocket cost for the hospitals by not screening, that they can pay them. Then you can, again, do the county-wide and calculate those numbers of injuries, calculate the number, the cost, the medical costs that are there. Some of those costs are absorbed by businesses, and some of those costs are going to be absorbed by the hospital. So being able to look at that, the Texas Health Cost Calculator actually breaks it out per survivor, and then does a larger number that would be the cumulative number. Hopefully that answers the question.
Okay, yes, let's see. I'm sorry, I'm seeing a few more questions come through. I just need to catch up.
Great questions.
Yeah, you're getting a lot of really great feedback. People are enjoying this. Someone else asked, did you say there was a way to get the numbers in their community? How do you get the numbers in your own community?
Right, so that's the fun part. So some of the numbers come from your law enforcement. You can pull in child welfare. If you have an embedded advocate in child welfare, we also have a way to calculate the benefit of that, the ROI of that program, but we didn't have it in the report. There was only so many things that we could do. So you can find the data usually through Florida Department of Law Enforcement. Again, we have a lot of those resources in our report about where that data comes from, and so it's all hyperlinked. So as you go through the report and you see a piece of data, you click on that, it'll take you right back to the tool that we use to calculate that information. And then you click on the tool and it'll take you to the web so you can go directly to that source. We tried to make it really simple for you.
Excellent. Well, other than just statements and comments, people are enjoying this and really appreciate the webinar. It doesn't look like there's any more questions related to this specific topic. So I suppose we can end a little bit early unless there are other topics that you would like to join. Actually, one person does just ask another question.
Okay.
How is the ER's cost impacted if they are told a broken wrist came from a fall when it actually was assault? Or do you mean something else by misdiagnosis?
Well, an injury is an injury, right? But if it, oftentimes we know that car accidents are caused by abusers, and so oftentimes survivors will come in either with an injury, but they'll also have other injuries. They might say, I've got a fall, I've got a broken wrist, but they might have multiple other injuries. Traumatic brain injury is often misdiagnosed in survivors. Injuries from strangulation and things like that. So if you know it's intimate partner violence, a couple of different things that you can do differently as a medical provider around the emotional trauma, around the physical well-being of the survivor, knowing that you're fixing the wrist and sending them right back to a relationship who might be injured again. And they also tend to order more tests or the wrong tests. So there's in that study, there's a very specific formula of what they calculate and why the costs are higher for the rooms and misdiagnosis.
Cool. Okay, there are a few more questions coming in.
Okay.
How would you apply this to a victim advocacy program in a prosecutor's office?
So there's a bunch of different ways. Again, you know, the need for advocacy is, this specifically talked about the benefit of the emergency shelter and the counseling programs provided, basically outreach and other counseling programs provided by domestic violence centers as cost benefit. But that doesn't mean that you couldn't take some of this data and start to look at maybe counseling provided or support provided. If you had the number of survivors that were then able to get away from their abuser because of the services that you were providing, the advocacy that you were providing, if you could show that the number of offenders that didn't recidivate, or that the survivor was able to economically be free from their abuser, all of those things, you could use that data and pull that data in and use that as either a positive cost benefit or a talk about the impact of crime. And I think, you know, the advocates in the state attorney's office have such a difficult job. There's so much witness tampering, and there's so much, there's only so much they can do, limited resources that they're given. And I know we had a large advocacy group in our court system, but it was always a daily struggle with over 10,000 arrests a year for domestic violence in Orange County. It was just overwhelming for them. So anytime you can make the justification for the need, and a lot of times, especially if you're in a government system, you have to make that justification by economic impact. And so if you can show that there are better outcomes when you're involved in a case, then, and if you had more advocates, you could be involved in more cases and more in depth. If you can show that, you can also show that the amount of money that you're spending when you don't have an advocate. So it'd be a little bit of a different twist on this, but that's what we're here to help with. We can kind of work through some of those things with you.
Excellent. This looks like the last question that's come in. Do you have any information about the percentage of young adults that have aged out of foster care being involved in domestic violence?
Yeah, we don't typically do the statistical evidence, statistical data on that, but I do know that I've seen that research out there somewhere around children aging out of foster care and the number who become either perpetrators or end up being victims of domestic violence, intimate partner violence. You know, and I'm actually getting ready to do a training on complex trauma and domestic violence, and understanding how really childhood trauma, you can't just talk to a survivor, and you all know this. I mean, you work with survivors every day, but you can't just look at a survivor and see what just happened to them and help them based on what the incident that just happened. But often people who aren't in the movement, that's how they approach survivors. You have to understand the impact of complex trauma on how somebody responds and survives and copes. And that complex trauma is present in foster children just by the very nature of the fact that they've had to be removed from the home that had so much trauma. So they are potentially at extremely higher risk. And I do know that I think the Child Traumatic Stress Network has some of that data. If I remember correctly, they're out of like Raleigh, North Carolina, or Durham, North Carolina.
Very cool. A couple more things come in. A woman says, I'm very concerned regarding the end results for families, the growing impact of enforcement of DV arrests on families, including female perpetrators who were formerly victims. Do you know of any available studies?
I know I'm actually working with a group that this is one of their priorities, is looking at survivors who are either falsely arrested. You know, again, that complex trauma. I ran a school for at-risk girls for 13 years, and we used to get angry when people would call them bad girls, and that wasn't the case at all. These were girls that had massive, massive levels of trauma, and they didn't always, and we all know this, I mean, we work with survivors, they don't curl up in a little ball and rock back and forth and cry. Sometimes they lash out and become violent, and it's just it's a trauma response. It's part of PTSD, and understanding that is really important. But I don't have that at my fingertips, but I could certainly, if you shot me an email, see if I have a couple of resources that we can connect with. And I have several domestic violence experts. Charity is all made up of nonprofit, former executives. Ari's the exception because she's my research assistant, but of people who've literally lived the work. And I have some amazing domestic violence experts on our team. And so I have a lot of people that we can tap that, and that's the beautiful thing. I love the community that Charity has built. Anything that your nonprofit might need, you can hire a Charity expert at significantly less than you would hire some other kind of firm, and we'll answer the questions for you quickly. The idea is to provide you with the best possible value, but also to help you free of charge, take the assessments and know exactly what you need. You're not paying for something that you don't. I've seen way too many nonprofits get ripped off by consultants. Not a pretty thing.
Last question that at least has come in so far is, will you be giving a training about complex trauma? And I can say from NCADB's viewpoint, we'll put that on the docket to explore. I think that's a great topic. And
Sure.
So
yeah, it's a great thing, and it's a different way of looking at survivors. But yeah, I'd be happy to do that.
great. Okay. Well, I'll share the comments and the information in the question box with both you, Carol, and Ariadna. You're getting lots of thanks, lots of applause. Thank you, everyone, for attending today and hanging in there despite the crazy technical difficulties today. If you could please remember to fill out the survey, that's really helpful to us. Again, we'll be following up with you with an email that provides a recording, the links to more information, the PowerPoint, the study, and additional resources, including a downloadable certificate of attendance. So thank you. Please watch NCADB's website for future webinars and information, and we hope to see you again soon. Carol, don't mind, I'll circle back with you right after this ends.
Thanks.
Wonderful. Thank you all. Thank you all. Take care.